Brian Moran, founder of Government CIO. Welcome to Government CIO Magazine.
Hi, I'm Michelle Shoker with Government CIO Magazine. Today we will be speaking with Stacy Cummings, Program Executive Officer of the Defense Healthcare Management Systems at Department of Defense.
I've actually found that there's much more commonality between federal agencies than there are differences. And the reason for that is really the people. So everywhere I've worked in the federal government, I've found talented and committed people. Here at PEO DHMS, we have a fabulous mission. And the people who work here are committed, and they know that every day they're supporting our mission, which is in support of service members, veterans, and their families. The one thing that I think I really did bring from DOT, some experiences that the Department of Transportation taught me, is how important it is to openly and transparently communicate with stakeholders. And that includes our stakeholders on the Hill, media, the public, to make sure that we're sharing with them information as early as possible and ensuring that they are aware of our status and the benefit that we're going to bring to our beneficiaries. Our business model here at PEO DHMS in the deployment of MHS Genesis is that we're leveraging commercial practices as much as possible. We're leveraging those commercial practices, but we're also bringing in DoD best practices where that makes sense. And one of the areas that we've brought the best of commercial and DoD practices together is in the area of testing. So as we went through our 3 phases of testing, we really brought forward the user in the process of testing so that they could identify any deficiencies early. One of the challenges that we had in the program as we were configuring and getting ready to deploy is that we had interfaces to unique military capabilities. And we, through testing, identified that some of those interfaces weren't working the way that we had intended. We were able to identify those early in the program so that we could take care of those right away, and that we would be able to fix them, test them, and then get the best possible solution to our users so that they would have a great experience on day 1. So that's one of the ways that we've been overcoming those challenges. The other challenge is deploying an enterprise-wide solution, not just a solution to a single military treatment facility, but a solution that's going to meet the needs across the entire enterprise. And so we're ensuring that as we're making decisions around the configuration of the tool, as we're making decisions around interfaces, and as we're testing, we're doing so to support enterprise-wide solutions and enterprise-wide needs. I think there are 3 key aspects that the program team, along with our contractor team, are leveraging to make sure we have a smooth transition from our legacy systems to MHS Genesis. So the first is testing, and I talked a little bit about testing earlier, is we have 3 phases of testing. So we started with the contractor-led testing, where they're testing to make sure the capability is working. And then we have government-led testing by our government engineers, and they're ensuring that the interfaces are working and that the capability is working the way we intended. And then we're also going to do a level of testing with the actual operational users in uniform at the local facilities. And so by doing this very rigorous testing, we're taking the best of the commercial model and the best of the DoD model, and we're working out our issues up front so that when we deliver the capability, we've already identified any deficiencies and fixed them before we deliver them to our customer. The next phase is a very robust relationship that we have with our functional users. So throughout the program, as we are making decisions about the configuration, about priorities, we are going to our functional community, and we have a structure to be able to ask them what their, how we are going to standardize our workflows, how to best implement this commercial solution to meet the very unique needs of the military treatment facilities where we're going to be deploying MHS Genesis. So that's the second part of the phase. And then third is change management. And here's where I think we're really leveraging those commercial best practices. So we're not looking at change management as simply a training on how to use the system, but it's actually looking at how do we best prepare the users with training, with demos, with briefings, with leadership interaction. We've developed super users who are going to be our ambassadors at the military treatment facilities to be able to help users answer any questions from an actual uniform care provider. And so they'll be able to hear directly from people just like them who are going through learning the system how to use MHS Genesis and how MHS Genesis is going to make their job better and easier. I think that there are a few key capabilities that the commercial tool that we bought is going to bring to the military treatment, to the military health system and the military treatment facilities that is going to enhance the experience for our users and our beneficiaries. The first is that we're deploying a single record, and that single record is for medical and dental healthcare. And so instead of having to use multiple systems, which is the way that our legacy environment is right now for healthcare providers, we'll have a single record that will track all of the outpatient, inpatient, and dental healthcare, and that will all be in one place, in one record, and accessible as soon as that data is captured. It will also be more usable. So just as we've all in our personal lives gotten used to having a modern system that you can click through and that makes sense from a workflow perspective, the commercial tool will be giving that to our providers, is that point and click, the standardized workflows that the tool will enable, and that will give the providers that standard experience and something more modern that you'd be used to seeing in your own personal life when you use your computer and you use IT tools. A higher level of reliability, so we're going to be hosting this single electronic health record in a single data center that has redundancy, and so it will be a more reliable system than our legacy systems are now. And then from an acquisition perspective, one of the most important things we get with a commercial electronic health record is every time our vendor partner upgrades their tool to meet the needs of their commercial providers, we benefit from that, and we don't have to make that investment alone. We're making that investment with commercial providers around the world, and so we're getting the best ideas from commercial healthcare as well as from military healthcare, and we'll be able to implement those much quicker than if we had to develop them and implement them alone. So one of the tools that we have developed is called the Joint Legacy Viewer, and we worked very, very closely with the Department of Veterans Affairs and established a tool that would allow the DoD and the VA to see each other's data. And that has very great impacts on health outcomes. A VA or a DoD doctor being able to see data that was collected at each other's facilities. But what we also found by becoming a member of the eHealth Exchange, which is a commercial interoperability organization, what we found is that we could also use that same technology to share data between our commercial healthcare providers and the military health system. And this has created great benefits. So in the military health system, about 60% of our care is actually performed outside of a military treatment facility in a commercial facility. So being able to use that commercial technology of eHealth Exchange and be able to connect with healthcare providers that are commercial providers, we've been able to leverage a technology initially developed for government-to-government sharing and use that for government-to-commercial sharing. And I think that we've done a great job of taking advantage of that technology, but also through our work of bringing people together, bringing government and industry together to share how important interoperability is and to encourage industry to invest and to focus on interoperability. In addition to deploying MHS Genesis around the world to our military treatment facilities, which are hospitals and clinics, and they're in fixed facilities, we are also this year going to start configuring and testing MHS Genesis in a way that it can be deployed to support our operational users. So MHS Genesis in a fixed facility environment will connect back to a single data center, and we'll have the connectivity to enable quick communications back and forth to be able to use the system in that way. As we deploy to Navy ships, as we deploy to a theater environment, as we deploy in support of the Army, the Air Force, the Marine Corps, and the Navy in their deployed models, we are configuring the same exact tool, but we're configuring it for a low or no communications environment. And so that is going to be something that I'm excited about this year, to be able to start to test that, to see how we're going to deploy that capability to modernize the care that we deliver to our warfighters in a theater environment. One of the other things that we will continue to work on is interoperability, as I've talked about. We did move our Joint Legacy Viewer program into sustainment, meaning that we've met sort of the acquisition requirements around deploying the system and meeting our basic requirements. Now what we're going to do is take what we've learned in the Joint Legacy Viewer, and we'll use that to continue to improve interoperability as we deploy our modern EHR MHS Genesis. So what I'd like for our beneficiaries and our healthcare providers to know is that we are fully committed to that mission, and whether our workforce is focused on the delivery of MHS Genesis to MTFs that are located around the world in support of an operational environment, whether we're working on standards that are going to help interoperability by having a common language between the DoD, the VA, and our commercial providers, that every day we are dedicated to making healthcare better by providing the military health system the tools that they need in order to deliver healthcare, and that they have the data they need when they need it, where they need it, and easily accessible. We have a fabulous relationship with the Department of Veterans Affairs, and over the years we've developed that relationship to ensure that as service members leave the Department of Defense, leave the military, and transition into Veterans Affairs for care and for benefits, that we can make that data accessible at the point of need. That being said, we can always do better. And so one of our goals over the next several years is to continue to make more data accessible, is to make sure that as we're capturing healthcare data at the point of care, that we're capturing it, that we have a standardized vernacular so that the data is understood between our two systems. And we're going to continue to get better and better in that, and as we invest in a modern commercial electronic health record, we're going to ensure that we continue to have the same level of interoperability immediately, but then we're going to continue to make that better. The safety of our patients and the security of our patient data is very critical to PEO DHMS and to the Department of Defense. As we are getting ready to deploy an electronic health record that will be centrally hosted in a commercial facility, we are looking at the best of commercial practices, and then we're bringing the best of DoD practices as well. So we're going to, and we have been working very closely with the Department of Defense and our administratively support agency, the Defense Health Agency. We're working with both of their chief information officers and their information assurance experts to ensure that as we take a commercial solution and apply those DoD standards, that we're looking at the architecture, we're looking at the tools, and we're looking at the processes that are being followed throughout our commercial partner to ensure that they're doing everything they can to protect the data that we're entrusting to them.